Good morning, good afternoon. This is Greg Cosgrove from the Pulmonary Fibrosis Foundation. I'd like to welcome everyone again as part of the PFF Disease Education webinar series with an additional installment focusing on COVID-19. And the focus for today is adjusting to a new normal. And obviously, I think we're all learning more about the impact of COVID-19 on our lives and those that we care about, and impacts us in so many different ways. And so we want to continue to have a virtual discussion. And I know some of you have submitted questions as part of the registration process, but I encourage you to type in questions in the group chat. We'll try to address them as much as we can. And obviously afterwards, if there, as typically happens, if there are more questions than can be physically answered during the call, we'll try to address them subsequently through the Patient Communication Center. And so I appreciate your attendance today and look forward to a great discussion. We have an additional member of the PF community who has spoken to this in this venue previously, but I'd like to welcome again Dr. Deborah Gillman, who's a clinical psychologist from the University of Pittsburgh and works in the interstitial lung disease program, as well as the Division of Pulmonary Allergy and Critical Care Medicine there, and supporting patients and their needs. And she's an expert in our field, addressing the psychological aspects of human disease and the impact of not only pulmonary fibrosis, but we'd like to welcome her today for her insights as to how do we all begin to address the impact of COVID-19 on top of the other chronic medical issues that we may have. So thank you so much, Dr. Gillman, for joining us today. And I'd also certainly, last but not least, Dr. Amy Case from Piedmont Medical Center and in Atlanta, Georgia. She is leading the educational initiatives here at the foundation. So it is through her hard work that these slide decks, as well as Dr. Gillman, were developed. So thank you again, Amy, for identifying the key issues with Dr. Gillman moving us forward. So to start off the talk, perhaps we'll have Dr. Gillman begin, and she's going to provide her insights to help us move forward. So welcome and thank you to begin with.
Thank you so much. It's always wonderful to be with the PFF. So I've been introduced very ably by Dr. Cosgrove, and this will be the focus of our discussion today. What I'm hoping to do is give voice to the challenges of this new normal, right, that we're living through on the mental health for those living with pulmonary fibrosis. And we're going to consider what kinds of coping skills can help, reviewing old and new. Old meaning old ones that we've talked about in this forum before, old ones that you may have used before to face challenges in your life, and then some new ones as well. So once upon a time, right, things have changed so much, and they changed so fast. When I think back to our lives in February and early March, it's like once upon a time in a fairy tale. Once upon a time, the following things were the focus of our attention with pulmonary fibrosis patients. I know in my own work, accepting the diagnosis and the path to diagnosis, the challenges of living with breathlessness, finding the right balance of activities and rest as that was changing over illness. There were appointments, medications to manage. Maybe you were participating in clinical trials or learning about them. Reckoning with a different degree of independence now with a caregiver as an important part of your life. Dealing with uncertainty about the future. Living with oxygen. And for some, the stigma of trying to live their life fully with oxygen. And family and caregiver stressors were prominent, of course, as always living with chronic illness. We worried about living well with pulmonary fibrosis, right? The whole world was out there. Pulmonary fibrosis was threatening to take us away from all the things, the activities that we held so dear. We were cheerleaders, right? My team they are the best cheerleaders for pulmonary fibrosis. The PFF is a cheerleader. Live your life, live with oxygen, make the adjustments that you need. We want you to travel if you can. We wanted you to go to pulmonary rehab. We were urging support groups, any kind of gathering of support. And then we were faced with what I am calling the big pivot, right? The whole message has changed, right? We used to say, get outdoors, and now the message is stay home. We used to say pulmonary fibrosis doesn't define you, right? But now we know that people with chronic lung disease are at increased risk for complications for COVID. We were urging you to expand your support system, right? Limit your, right? And now the message is, please limit your contact as much as possible. We were encouraging support groups, and now no groups. From go to pulmonary rehab, and then pulmonary rehab gyms, for the most part, shut down. From living fully to living carefully. From extra caution during flu season, which should have been behind us, to living cautiously in every season. From the safety of your providers, the safety of your hospital, your physician's office, to be careful. Don't go to the doctor if you don't have to. Don't go to the hospital if you have to, right? Some people are participating in these sessions from all around the country. And we know that some regions have been very strapped, hit heavily by the disease, and hospital systems were overwhelmed, and people were encouraged to stay away. Well, we're not used to thinking of our hospitals or medical providers in quite that way. A huge pivot. The pandemic has required that people with pulmonary fibrosis, right, re-envision your world, re-envision your lifestyle, okay? And I say again, because with your diagnosis, there were so many hard-won adjustments that you had to make to live your life. And now these maybe seem to have come to nothing, right? Why did I make all those changes if I can't even implement them? Why did I get so engaged in that support group or in pulmonary rehab, built up the motivation to go to pulmonary rehab, and now I can't even go? So many very real worries now. Will I get sick? What if my caregiver gets sick? How brave am I to face this very significant challenge? How much fear can I tolerate? How much loss can I tolerate? And when I refer to loss, I'm thinking of further loss of independence, loss of opportunity, a sense of lost time perhaps. And then, of course, many people may have really been enduring losses in their family or extended circle. If you know people who have been hit by the pandemic, I'm not sure I can stay positive. How to stay positive? Will I lose my physical strength, right? If I don't follow my usual walking or fitness or activity routine. And if my friends and family are struggling, will they still be able to help me? Now, whether you're working or retired, right, we know that the pandemic has wrought a huge challenge on our economy, so many struggles and job losses in this country. And, even if it doesn't hit you directly, how could it not impact us, in our extended circles of friends or families, if they're struggling economically or if they're struggling with job loss? What is that going to mean for their ability to give extra energy or time or care to us? So this is where I want to turn to what I call to the complexities of coping, okay? Have I been here before? Well, we haven't been exactly here before. But we've been at challenging places before, all right? Coping is never a one-time deal. It's always a process, okay, of problem solving and then more problem solving. See if you can think of examples in your life where you've had to regroup. One example might be during one phase of your illness, and then if illness has progressed, okay, it's required a different degree of coping, whether it's your pulmonary fibrosis or some other example of illness or caregiving in your family. Another example that I think of is, well, if you've raised children or are raising grandchildren, right? The care demands of an infant are different from the care demands of a toddler, different from a child, different from a teenager, right? as we go through life, we are often having to regroup our strategies and revise our coping. So I want to encourage you to think about what's worked before, okay? We're going to talk more directly about coping strategies, but think of what's worked before and also look for new strategies. Now, what about the homebodies among us? I've been asked, is everybody extra anxious these days? And guess what? Not necessarily, right? For some people, the stay-at-home order was a relief. That doesn't mean that they take any sort of relief in the circumstances in the pandemic. But for people who really prefer to stay home, for people who are struggling to force themselves to live that full life mandate, and now they're asked to stay home, well, for some people, a contained lifestyle is just fine. For others, it's fueled anxiety, but for some, we just have to recognize, for some, it's been a very simpatico state of being. So we should acknowledge what aspects of this are working well, right? Many patients with lung disease were exceptionally well prepared for the changes demanded by COVID-19 or a quarantine lifestyle, right? Certainly compared with other folks in the population. You may have already been avoiding crowds. You may have already been minimizing travel or being cautious with travel or eliminated travel. You may already, be very cautious about hygiene, always washing hands, treating every season like flu season. You may have mastered technology already, FaceTiming with grandchildren, ordering things online, right? Using technology to your fullest. And you may have really decided who are the members of your support system, who you can count on and with whom you have regular contact, and you've settled into that. So certainly if it's not broken, that's fine. Don't fix it. Use what's working well. But bear in mind, right? The mind-body connection is at work even when the world is changing, all right? And in previous seminars I've spoken, and in a wonderful webinar that the PFF sponsored earlier in the month, we focused on the mind-body connection, right? What's going on in our minds is always communicating with how we feel in our bodies, okay? Please think about how you talk to yourself about what's happening in the world. And I'm giving you two options. Consider A or B. What is the impact of each voice? If the sentence you say to yourself consciously or unconsciously every day is, the world is a dangerous place for me, especially with pulmonary fibrosis, right? If you're always saying that, what's the impact on how you feel? As an alternative, if your point of view is, I must always take care like I always do, and now in some new ways, okay? To me, each of these, just back 1 second, please. Each of these sentences has a different implication. The first one is a statement that's going to increase the level of alertness, or our bodies have an inborn fear response system, right? You might be living in that fear or fight or flight mode, but you're always thinking and fearing danger. But if you can speak to yourself in a way that validates what's happening, but is a little bit more measured and is a reassurance, then you can benefit from the feelings that come from thinking that way. That's the mind-body connection is always active. So you may have adapted to the new normal, but guess what? Now we're facing the next new normal, all right? If we had done this session 6 weeks ago, we might have stopped here, right? But now if we've gotten comfortable with the smaller or more contained world that we've occupied with familiar routines and supports, guess what? Now there's a new challenge. I consider this the next pivot that the world is demanding of us, okay? And that comes with the reopening of our communities. We may have experienced some relief, right, at having weathered the worst. Our communities are are doing well, which is, we're reopening out of some safety. We may feel reassured now that the worst is behind us. We may be resuming some more social life, right? And after all that isolation, who wouldn't? But there's also a return to more uncertainty, or a continuation of a good bit of uncertainty, right? We have to make some new decisions about what kinds of limits we're going to set. When we weren't seeing anybody, there weren't decisions to make. Well, now if we can see a certain number of people at a certain distance, and different families interpret that differently, it's complicated, right? There's new information every day. How do we decide, right? Uncertainty always breeds more worry. Next slide. I want to turn now to what I referred to before as the fear response system that comes with a sense of danger or a heightened sense of worry, okay? And which is the role of anxiety and how it can be emphasized in folks with breathing disorders, okay? The thing to know is that the same part of the brain that controls your physical symptoms of anxiety also controls your breathing, right? That's that inborn fear response system. We also know that shortness of breath causes fear and can condition a person to feel anxious. When we're thinking of anxiety, we always want to say, what are the triggers? And the triggers can come from your body, right? From shortness of breath, or from subtle breath holding that comes with more physical tension. The triggers can be in the environment. Well, we certainly have those these days. Or they can be in your mind. The worries, fears. When people say it's in your head, I don't discount that statement. I say, yes, absolutely. It's in your head and in your body and in the world. And so the pandemic and the combination of pulmonary fibrosis is a very sound trigger for anxiety and would explain why many of us are feeling more anxious. In terms of treatment for anxiety, there's some different options, okay? There are, and we'll talk a little bit more at the end about the role for therapy, some talk therapy, okay? There are, the supports and resources that we have in our own homes, in our close support system. There are behavioral strategies such as diaphragmatic breathing or belly breathing. There may be a role for medication. There may be a role for improving your use of oxygen, right? Optimizing oxygen, okay? And we know that the better your conditions, the better you can manage breathlessness and get a better control of anxiety. And of course, it's harder with the challenges during the pandemic. I'm going to add in just a few words about depression before we turn to active approaches to coping. We know that this is a challenging time in this country for mental health generally. And a recent study, the University of Michigan found that over 30% of American adults have some symptoms of major depression. Now, that doesn't mean that they have been diagnosed with depression, but are exhibiting symptoms of depression. We also know that the prescribing rate of antidepressants increased 18% from the middle of February to the middle of March. So there's certainly, the worry is pervasive in this country. And what we want to think about is, always the difference between what would be a normal, expectable, low mood or blues in response to what's happening versus something more in need of professional attention. And that's where we're going to focus now. First, let's think about approaches to active coping, right? Self-care. Please think, what am I already doing that helps, okay? What are the parts of my routine that help me feel like myself, that help me feel calm? You may not think that your morning coffee, is therapy, but in fact, it may be one of the most therapeutic times of day, right? Try taking it away. Here at tune into what are the aspects of your routine are therapeutic for you. What are the hobbies? What are the small things that you love to do that you're still able to do easily? Is prayer an important part of your coping? Is listening to music an important part? Are you making an effort to limit your exposure to the news, right? Very often, the more we listen or the more we tune in, we can feel our heart rates increasing. I think it's important just to decide what you're going to listen to and when. You'll get the news when you need to. Think, what are the continued sources of competence? When do I feel like my best self? What are sources of joy? What are sources of strength? Can I accept this remote or online help for now, right? Whenever I'm speaking with the PFF, I'm always preaching to the choir because here we are in a webinar together. And kudos to you for joining in. And if you missed any, they're on the site. Now, FaceTiming with grandchildren is not the same thing as hugging them, but can you accept it for now? Many spiritual organizations are offering online services, sermons, scripture study groups. Can you find those for now, whether yours or it's time to visit another community and see what resources they have, right? Think about who can guide you through an appropriate at-home fitness routine. I know our pulmonary rehab in Pittsburgh posted some videos, and the internet is not short on online exercise tutorials for anyone and everyone. That's, of course, on my to-do list for later today. And are you willing to try something new, right? I've never been a meditator, but maybe this is the time. There was a wonderful webinar from earlier this month on meditation with some other wonderful exercises for managing worry. Check that out. There are so many resources, and the PFF is going to have some additional resources that they're posting for sure. Are you willing to try something new? This is the time. Okay. All right. These are the depression numbers that I did reference, just in a different place than I expected. But as we said, right, it's a very expectable time to be dealing with some low mood. Next slide, please. Okay. When is it time to find professional help? I'm often asked this. Well, if you're feeling too overwhelmed, too anxious for too long, too sad or too despairing or too hopeless for too long, right? If you're not just dipping into that state of mind that's worrisome, but you find it you're occupying it and it seems to be too pervasive. If your functioning is really poor beyond what you might expect as a result of your illness, right? Not just sleeping more, but unable to get out of bed would be a distinction. If you're getting feedback from your loved ones that you don't seem like yourself, if providers even on video chats who know you well are concerned about you, if you're feeling that your care partner has a very significant burden and you'd like to remove some of that from that relationship and speak to a professional, you may want a confidential setting to talk about some of the things that are coming up for you or to find some new strategies. And if you find that you're coping, if you recognize that your coping is maybe not so good, right? An example of that would be drinking or drinking too much, right, as a way of coping. The good news on this front is that there are more options than ever for counseling, okay? The field has changed dramatically. I converted my entire practice to telemedicine within a week, and this is happening throughout the country. There are more options than ever before. It's easier than ever to participate in a counseling session. You don't have to take your oxygen, get into the car, drive, park your car, wait, right? Deal with some of the stress about going into a counseling session. It's easier than ever. It's also easier than ever for therapists, right? They have a lot of supports. Regulations have changed to facilitate their billing for online services, so they're able to do it very freely. Center for Medicaid Services Center for Medicare Services and Medicaid are reimbursing video and telephone sessions, and even groups are running online. It's a huge change in this field, dramatic change. I will say that before this period, I was not conducting video sessions, and I was not keen on them. And my position on this has changed dramatically, and I have found that they can be quite effective. So do give it a chance. Here are some resources for finding a counselor, right? You have to find somebody who specializes in lung disease. Well, not necessarily. It might be nice, but it might not be possible. But there are other good therapists out there, and particularly there's a real universal understanding of some of the challenges that we face, and a good therapist who can listen to you and the specifics of your life should be able to get up to speed. Our primary care doctors or clergy, friends, word of mouth are all good options. Hospitals have outpatient mental health departments and can be a resource for referrals. These are two websites, the Psychology Today website and the Association for Depression and Anxiety. And the links are here. And they have therapist finders by zip code. Regarding medication, well, some people are on medication or have been taking medication and are not engaged in counseling. Some people are benefiting from talk therapy and are not interested in and or needing medication. For the most significant anxiety or depressive disorders, the combination is the gold standard for treatment, but that doesn't mean that many people do well with one or the other. Certainly your physician, sometimes a pulmonologist will do this prescribing, psychiatry, and many palliative care physicians, if they're on your team as well, are the people who would prescribe if you had questions or interest. So thank you so much. Stay safe and stay well. If you do have questions, type them into the group chat, and I know Dr. Cosgrove will be fielding some questions, and I'm happy to answer them toward the end of the hour.
Thank you so much, Debbie. I think one of the unfortunate things that occurs with the terms we use is that we are pushing social isolation, quote unquote, which we really don't want to do, as you alluded to. We want to have physical distancing so that we can limit the risk of transmission of the disease. But I think to your several slides, what you're advocating for is we really need the ability to interact with individuals, to talk about our, frankly, fears and anxiety, and figure ways in which to cope with them, since it's so prevalent throughout all of our society right now. Is that something you try to address with individuals to make sure that they're not isolating themselves? Is that
yes,
what I was speaking?
Yeah, and again, different people have different thresholds and different levels of need, right? I think some people are finding that they don't need as much volume of contact with different people as they thought they did, but it's the quality, right? It's the people who really can meet you where you're at, and kind of are finding the people who are the greatest support. So listen carefully to who's really in sync and attuned to what you need. Figure out who are the people that are giving you what you most need.
One of the questions that just came up that I think it's best for you to address is, are there medications that work for depression or anxiety specifically for patients with pulmonary fibrosis?
It would be up to the physician. There are many medications that are both, work on anxiety and depression in a class of, what we consider antidepressants, which also treat anxiety, that are well used, well known, commonly used, and are perfectly safe for people with pulmonary fibrosis. But what your physician would be considering would be certain classes of medications for anxiety that might not be the best for people with breathing disorders, but there are, sort of fast-acting medications that, in the class of, that would, calm your breathing too much. But there are many medications that are safe and very commonly used for people with lung disease and for people with pulmonary fibrosis.
Okay. And as always, you really want to minimize side effects and intolerance and maximize the intended benefit of antidepressive or anti-anxiety medications, just as we do if you're on antifibrotics or antihypertensive. The best medicine for any one patient is the one that they have the least amount of side effects and provides the intended benefit, and it might change from one patient to the next. So it really is that discussion that's really important to have. Well, thank you so much. I think with that introduction and providing those skills, what we thought, and Dr. Case is going to maybe go through this in more detail, is a quick update. What's clear about COVID-19 and the pandemic we're living in is things change, and they change maybe not on a daily basis, but every 2 or 3 days. But I think what is quite common is the questions that come up. They can be the same questions week after week, and we may not have an answer, but I think we can begin to have a better pathway forward. So that's how we want to proceed with the update. And then I see a lot of questions that are coming up, so we'll certainly want to leave some time for them and try to address them, because a lot of them are very, very insightful. So I'd like to reintroduce Dr. Amy Case, and she'll work through some of the quick recap. And I encourage those that weren't on prior sessions, those are online, and you can download and read through some of the sessions on COVID-19 that addresses the knowledge, at least from 3 weeks ago and 5 weeks ago. Amy, thank you so much for putting the recent update together.
Thank you. And thank you so much, Debbie. That was wonderful. Just super helpful as a provider, as well as somebody who's living through some of these same things. So I'm not going to rehash you. I would, just as Greg has done, encourage you, if you weren't able to join us for our last few webinars, to go to our website and review those if you're interested. I think it's hard at this point, unless you have been underground or on a boat for a lot of months without contact with the rest of the world, to know that we're not living through a global pandemic now. COVID-19 is a disease caused by SARS-CoV-2, which is a virus that has spread very quickly across the world. We focused a lot on our previous sessions on social distancing and the risk to our pulmonary fibrosis patients. And now here we are with COVID-19 still being a big problem, but thankfully in the United States, our curve has flattened. And that means that the number of new cases every day is not increasing, but been about stable and maybe starting to drop off a little bit, which is great news. So we have, as we have said, flattened the curve, and in most areas have not overwhelmed our healthcare systems, which is the point of the social distancing, curve flattening, and protecting those most vulnerable to the virus. But now what? Because every time you turn on the television or listen to the radio, we start hearing things about going back to opening up and opening businesses, opening cities, opening states, and things like that. And so is it that this is a common scene that we're going to see in the future, or are we going to see sort of a change and a new normal, and maybe beaches look a little different, and businesses look a little different, our lives look a little different, just as Debbie had referred to. So how do we open safely? Well, some of those are questions for our state and local governments, for the federal government, for our businesses, and for leadership around us. Since SARS-CoV-2 or COVID-19 is still spreading, but there is this economic and social push to reopen. Many states have lifted more restrictive limitations on businesses and on people's movements, although there are many states that still have restrictions that are in place. There are others that have lifted many of those, and some that are approaching essentially business as usual from the business and state and local government side. There's lots of media coverage on this with restaurants and churches and other businesses and vacation destinations. I'm sure we saw media footage from beaches and pools over the Memorial holiday weekend. And so we ask ourselves, is it safe? And pulmonary fibrosis patients continue to have some of the highest risk of severe illness with COVID-19. That hasn't changed. If you've not been exposed and recovered from COVID-19, there is no vaccine, so everybody who's in that boat is still vulnerable to being infected should they come in contact with somebody who's carrying the virus. The COVID-19 is likely to be an ongoing risk for many months or even longer. And Open Safely, as you see the hashtag and website here, it reflects a set of recommendations for a sequential opening strategy that balances the economic interests with people's health. But they would go back to saying that even in spite of some of these sequential opening recommendations, Americans should still stay home whenever possible and continue social distancing. And the focus on being safe is focusing on testing, contact tracing, public health, and protecting our most vulnerable populations, and that would include our pulmonary fibrosis populations, and opening those lowest risk environments first. And I thought this was a nice graphic from my own home city of Atlanta over the weekend. So during the Memorial Day holiday, they recommended some safety measures to think about, keeping 6 feet of distance between yourself and others, washing hands with soap and water, wearing a mask in public. But I'd like to highlight here where I put the circle to protect the most vulnerable. So even in spite of lifting some of the restrictions on people and businesses, that the recommendation still is that the safest place for our highest risk and most vulnerable individuals is at home. And so that's something we have to consider. Now, how do we balance risk with our activities in question? I think it is important to remember that some movement outside the home and some activities that we undertake are important for our physical health, our mental health, and safety. And how do we balance that against the risk of being exposed to COVID-19? And Greg, I'll give you a chance to give your thoughts on this, but this was an article from the Wall Street Journal a few days ago saying that it is deadly to fear the emergency room. So people who, unfortunately, during some of the worst of the pandemic, particularly we saw this described in New York, but I'm sure it happened other places, they had acute medical concerns that would have otherwise prompted an urgent or emergent visit for being seen. They were afraid to do so, unable to do so, and that can result in some pretty significant negative consequences. And so we don't want people to be so afraid and so risk averse that they're not caring for their immediate health and safety. Greg, do you want to comment on that?
It's a really great point, and it's obviously scary. Number one, when you have new symptoms, certainly, God forbid you're having chest pain and could be having a heart attack, and you're worried that you could be infected with a dangerous virus. That is overwhelming, to say the least. But what I would say, in contrast to February and early March and now, is that the protocols and emergency rooms and clinics throughout the United States have really been well developed, so that those who are known to have COVID-19 are sequestered from those individuals that are not. And so I do believe the risks are lower. And unfortunately, if you are having a serious medical issue, that has to be addressed, because we're trying to risk reduce. If you have an active problem, we have to treat that problem. The risk is inherent. And so I think that you have to be in contact with your physician, and certainly with any new symptoms like this, calling ahead and trying to get the most expeditious and safest pathway to get your care is what I've been telling my patients. And so just showing up to the emergency room, if you have the luxury of calling ahead, if you have the luxury of speaking to your doctor, that they can make it safer for you to reduce the risk of any exposure while getting treatment for, God forbid, your heart attack, or if you're having common things like a attack in your gallbladder that needs emergent treatment. So life goes on through COVID-19, and we have to pay attention to the other medical issues as well as trying to prevent acquiring any infection. And as you alluded to, and I think it's a really important phrase, patients with pulmonary fibrosis are in a higher risk category for having complications. We still don't understand why some patients, some can be completely healthy without any disease, go on to severe disease. Some patients can have pulmonary fibrosis and they tolerate infection with COVID-19. And so there is a lot of uncertainty. And so that's why the underlying word in that sentence is increased risk. It doesn't necessarily mean that everyone is going to get catastrophically ill. Much the same as pulmonary fibrosis in general. We know everyone's disease is different, and not everyone has a progressive course. Some have a little bit more stable, and so it's a challenging time. But I think communication is the most important aspect, as you alluded to.
Thank you. So how do we find balance? I've been getting a lot of questions in my own clinic. When can I see my family again? When can I see my grandkids again, of course? Is it safe to go to the doctor? When can I get a haircut? And when can I go to church? And when can I go back to some of my other group activities that I previously enjoyed? And so we would emphasize that where health or safety are involved, it seems very clear that the risk of contracting the virus is acceptable with appropriate precautions. But for some of these other types of activities, we really need to think about and balance the different factors that surround those activities. And so just thinking about virus-related factors first. What is the prevalence in the area where you are? What is the testing capacity in the area? Are there people that are doing contact tracing for outbreaks? Do you know when that's happening? What is the exposure risk of the people that you might encounter during whatever activity you're considering? And do those people share your practices to reduce risk exposure, or are they playing a little more willy-nilly with their own exposures, and then those exposures, if you're interacting with them, would become your own exposures? Think about how essential is the activity itself. Is it health related? Is it safety related? Is it necessary from a functional standpoint to have done? Does it affect your mental health, your family, or is it something you really kind of do just for fun? And there are other virtual or other less contact prone alternatives for that. Then think about the environmental factors. So I really like this graphic in terms of harm reduction tips, as well as reducing the risk of transmission based on the level of risk of the inherent in the activity. So we really can't tell you at your level of risk with any individual activity what is safe or not safe to do, and advise you, even in my own clinics with my own personal patients, I'm not telling them something is safe or that they absolutely should not consider a thing, but there are levels of risk, and we have to go back to what is the balance of the risk versus how essential the activity and how important it is to you personally, and how willing are you to take that risk of exposure when undertaking that activity. So we know that the safest place to be is at home with your own home contacts. Your own family is the safest place to be. And minimizing trips to non-essential places. Certainly, we've talked in the past about grocery shopping and going to doctor's visits when they're necessary in person, things like that. But that keeping those to the essential minimum, and otherwise being at home with your family. And by home, I mean in your yard is fine. You could be outdoors. You don't have to be inside, but at home and surrounded by your own family that you're in contact with all the time that is doing a similar type of restrictive activity. Next, in terms of level of risk, would be being outdoors with other people that are outside of your own home environment. So getting outdoors is not a bad thing. Getting outdoors with other people that are outside of your own home increases your risk because those people have different exposures than you do. And when you get exposed to them, you were exposed to their exposures as well. Okay, so now outdoors is a more safe environment than indoors. You'll see that across the slide there, where a gathering of a group outdoors, so a large group of people, a backyard barbecue, a picnic, something like that, is higher risk than activities outdoors with a few other people. And an indoor group gathering is the highest risk for transmission of the coronavirus. Being indoors in a enclosed space with a large group of people is where we hear the most about outbreaks in different areas of the country, and where we can see by virtue of contact tracing that some of these outbreaks have started. Now, how can we reduce the risk in any of these environments? I would say, potentially not wearing a mask at home with your own family because you're really having the same exposures anyways. But when you're outdoors, if you're not distant from other people or in a group setting, a mask for everyone is important. We do get a lot of questions about masks and or wearing face coverings. That we want to remind people that a mask or a face covering is more protective of the people around you than it is of you yourself. And so mutual face coverings or mutual mask wearing in a group is sort of maximally protective of each other, and it's sort of a communal activity, I guess you would say, that you are protecting others and they are showing respect to protect you as well. Greg, do you think that answers some of our most common face covering questions?
It does, and I think might not come as some surprise to the patients in the audience that it's hard to wear a face covering or a mask, and it can result in further anxiety. So if you're having a hard time breathing and then you have to put a mask on, that's come in through several questions in the PCC recently, and it emphasizes in that circumstance when it is challenging to wear a mask, either in health or with an underlying lung disease, then the focus really should be on distancing. And so that's probably the primary way in which to reduce risk for the individual. And as you alluded to, the facial mask reduces the risk for the group. And so if you're having a hard time wearing a mask, then really the secondary preventive strategy is that social distancing so that you're just not exposed to the virus. But it is it's challenging, and people talk about masks, which is the best mask. Well, in a perfect world, we all could have N95 masks, and they provide the individual who's wearing it with protection. In the world that we live in, unfortunately, that is a scarce resource that's being limited to healthcare providers, and so that they can continue to provide the care and protect them. And so in patients that say, which is the best mask should I get? What we've been encouraging is, and I think the CDC as well, is you really want to have that resource to continue to protect the nurses and the therapists and everyone else that's providing care for the patients who have active COVID disease. And the rest of us, we're reducing exposure by wearing a facial covering. And perhaps that's a little bit easier to wear. It just depends on your level of comfort and your underlying lung disease, and frankly, how you handle the anxiety of having something over your face, and that is it varies from person to person. So there's no perfect solution, but I think working together is, as you say, that taking steps to reduce the risk, and then it really is an altruistic approach to by helping others, you help yourself, because the whole community protects each other.
And that's sort of a theme throughout this whole pandemic, is that we all stayed home. those of us that absolutely could and were essential. We stayed home to help each other, and now we think about these other risk reduction strategies like facial coverings, social distancing, limiting numbers in an enclosed space and outdoor space, making sure that we wash our hands, and keeping our direct interactions brief, and then avoiding shared utensils and toys or sports equipment, and sanitizing those surfaces when we're done with them.
And Amy, that brings up another issue. I thought it's a good time. We've gotten a lot of questions about, well, what do I do if I'm out and I'm going to pick up my medicine, or I have to go see the doctor, or I'm walking in the park? How do I clean my portable oxygen concentrator or the compressed oxygen tanks? And I guess that there's no protection in terms of the material that the different tanks are made out of is not antibacterial or antiviral, so it doesn't have an inherent protection. But certainly you want to check with the manufacturer of any one POC to make sure if they have recommended cleaning. But just like you talked about cleaning the sports equipment or other things outside to reduce the risk, regular cleaning of the POC or your portable oxygen equipment or your oxygen tanks is important if you are outside, just like you would do, washing your clothes and things like that. There aren't inherent filters in the equipment that filter out the virus. But I think if you're cautious with your social distancing and you clean the equipment appropriately, then I think just like you do with other aspects of your life, you're reducing the risk. And I would caution people to try to be perfect, because there is no perfect strategy, and to make the risk zero, but we want to minimize the risk as much as possible. But trying to achieve perfection is anxiety provoking unto itself. But I think there has to be a balance as we go forward, that if we isolate ourselves, just like Debbie said earlier, that has consequences. So we want to be practical and risk reduce as much as possible, but also try to be balanced as much as we can. And I think that happens. I would not like people to sequester themselves and not get outside. We just don't want them to do it in the beach scene that you had earlier in the slides with people 2 feet away from you.
Certainly not. So here we've heard a lot of examples of outbreaks and some events and activities that we know can be high risk. And this is not to scare anybody or tell people that they can't do a thing, but I want to emphasize that there is risk, and that we have to carefully think about the level of risk and how to risk reduce before engaging in any of these activities. So we've seen examples of swimming pool parties, a hair salon. There are several outbreaks that one particularly in the south of Georgia that can be linked directly to a funeral. In my own community, there's an outbreak currently going on among some high school students that attended graduation activities and fitness dance classes and church choir and church activities. So we've seen a lot of these things happen, and again, I think that these are illustrative of the risk of particularly large group settings, and particularly indoor large group settings. Of this case that was published, this is from the CDC, talking about a case where 2 patients had gone to church events early in the pandemic, so early March. They infected dozens of people that had attended that service, and from that primary infection, there were additional cases that spread out from that center, and it very impactful to that community. So it's not to say that I'm not trying to be pejorative in any way. I think that it just highlights that indoor places with groups, with people that are talking potentially without face coverings or singing, as exemplified in the choir outbreak, can be very risky. And we don't necessarily know when people who have COVID-19 can be carrying it and not yet have symptoms, or maybe never have symptoms. And so just having people who are not sick stay home doesn't necessarily protect us in those types of settings. So just to kind of wrap up, and I hope we've left a few minutes for questions, staying home is safest. But we do have to navigate this new normal, and hopefully we've given you some food for thought and some tools to think about the level of risk in the different activities. Even if we haven't mentioned them specifically, you can think about them in these certain categories of low, moderate, higher, and highest risk when we're thinking about undertaking them. Just a few other things about, we might want to think about, well, when is this going to change? There's a lot of effort going into development of a vaccine. There are many vaccine candidates that are starting in trials now, and hopefully at least one of them will be successful and move on to be able to be used in the general population. But that remains to be seen. The safety is being tested now. The effectiveness is also being looked at, but it's just like any new therapy or prevention in this case, it has to be tested to be shown to be safe and effective before it can be used broadly in people. We've got some great news recently about the effectiveness of one of the antivirals that was being looked at for hospitalized patients with COVID-19, a drug called remdesivir, which is not FDA approved yet, but it is emergency authorized for use in patients in the hospital now, because it does seem to be helpful in the treatment, even though it is not curative. And so while we're sort of chipping away at getting towards some more effective therapies, it still remains pretty far away that the landscape is going to be safe for anybody, particularly our high-risk patients.
Amy, that gets to a theme through several of the questions, and perhaps you and Debbie can comment on this. It's, what do we do if things are opening up? How do we mitigate those risks? And one comment was, should individuals who are at high risk continue to social distance themselves and frankly stay home, or how do we re-enter society? And I think to your point, the way in which patients who are in the higher risk group can begin to re-enter society more safely is contingent upon, I think, three factors that you touched on. One is there treatment for those who acquire the infection who develop serious illness? And right now, that treatment is available only for those with a very severe disease, those that are on the ventilator. And so that we prefer not to have anyone get to that point. But if we develop a treatment that someone who is not that sick can be treated and reduce the risk, that's one possibility, and that would allow people to more safely re-enter society. At least that's my thought. The other common theme is, where are we with vaccinations? And certainly if we had immunity and had antibodies that neutralize the virus, that would make it safer, if much the same as your influenza vaccination, to reduce the risk of serious illness if you contract COVID. And so right now we don't have those tools to combat COVID-19 if you get infected. I know there's tremendous work and there's some encouraging news over the past 2 weeks, steps forward, but it's not available yet, and it can't happen soon enough, but it's not going to happen this summer. And the last, I think, is knowing who's infected. And is it safe to have my granddaughter over? Or what about the kids going back to school in August? How do we handle that risk? And they're really great questions, and I don't have clear-cut answers for people. It makes it very challenging because we can't effectively treat those that once they're infected. So not getting infected is the best treatment until we have those tools. But that results in a lot of anxiety and a lot of frustration. So I'm curious. I don't have answers, but I think the group really needs some guidance on how to move forward with those questions.
As for people who are saying, well, I know that we're allowed to go out now, but I'm not going anywhere. I work with, a lot of lung transplant patients, and I think some people are electing to sort of stay the course as if they were still under a stay-at-home order. And I think I always want to respect, what people feel they need to do. And I think that, Amy, you've provided a great rubric in these slides for how to minimize risk. And I don't really believe that there's anybody who could not take a walk. I mean, it's possible that you live in a very crowded area. I'm encouraging. I guess I'm always attuned to what is, the factors driving decision making and how much it's, just sort of purely fear-based, or is it, you want to take the fear, you want to take the data, but you also want to attend to your needs and your need to. You can't just sit in the living room, right? That's not going to be good for your lungs, right? You have to still be active. So, is there some outdoor space? And what if you are electing to be very conservative in your approach to stepping out or to the reopening, then what are you doing to minimize the isolation, right? So I like to try to think creatively with folks who are electing to, pretend as if nothing is changing, but still respect their choices.
I think those are really good points. I think I would use the term calculated risk. So we hopefully we've taken away from this, at least some ways of thinking about the risk factors inherent in the activity, the virus-related factors. We all have different levels of spread in our own communities. And so we can, follow the news or our local departments of health and try and figure that piece out. But also, the essentialness of the activity and weighing those risk factors against, your own need and desire to do that activity in the first place. And if we're thinking about those things and calculating what the risk is and what we are willing to accept in terms of risk, then I think that becomes a personal decision and empowers us to make those choices. So I've thought about it. I understand the factors. I feel like this is an activity that I'm going to do. Maybe it's the one activity that I'm going to do, and I'm going to do it in the safest way possible. Then that's an informed decision that you've made. And in medicine, we try to make informed decisions by weighing the risk and the benefit of that decision that we make. And so I think this is a very similar process of hopefully informed decision making and calculating the risk to ourselves.
I really, I completely agree. I love the language that you're using, the way you said that, and I also say in anxiety management, I always like to emphasize planning. So decide, as you say, what you're going to do, and then plan for it, right? So you're not blindsided. So you have what you need. Let the other people know what you're planning, right? So that there's no miscommunications around how long you're planning to stay or what you're willing to do in the space where you are. And communicate that so that you maintain some control over your plan.
Well, we are a little over the hour, and I think we've had a great discussion. Thank you, everybody, for tuning in again. Thank you Thank you, Debbie, for being here today for that wonderful discussion. I want to remind everybody about our COVID-19 resources on the Pulmonary Fibrosis Foundation website. They are prominently displayed on the banner at the top of the screen. There's a number of resources there, some frequently asked questions and fact sheets that are being updated as new information becomes available. And we've already been through the question and answer of this. And I'd also like to thank Greg for moderating here and for fielding those questions, and let everybody know that we do have another webinar planned towards the latter half of June, where we'll be addressing some additional topics pertinent to both pulmonary fibrosis as well as how the COVID-19 pandemic is impacting everybody. So thank you very much, everybody, for being here. Greg, do you have any last things that I've forgotten?
Just that we couldn't get to all the questions, tried to address kind of common themes, but really wonderful questions. We'll try to incorporate them into the COVID FAQ or in other arenas and get back to you about your specific questions. So thank you very much. Thanks to both of you, and hope everyone has a wonderful day.
Thank you. Goodbye.